welcome everybody. Thank you for joining us today. My name is Tanya and I'll be moderating this discussion. This discussion is on the impact of COVID-19 on girl-child education and how India is working to bring girls back to schools. Like many of you must have been reading and must have heard, one of the most affected sections of society since the first wave of the pandemic has been the marginalized communities. And in that, it has been girls. As far as education is concerned, they have been pushed to the peripheries, and there are very little solutions visible to them right now, and too many challenges visible in front of them right now. One might say that all the strides that India had made with regards to education of girls took a very severe beating since the onset of COVID-19. There have been so many factors, right from early marriages, right from families losing their livelihoods. These are all, and above all, the digital divide that is in front of these girls. They have just pushed them way too many steps back. They have led to extremely low number of enrollments in schools, and they have led to a large number of dropouts. We are here today to discuss this and all the solutions that are around these situations. With this webinar that is being conducted by the Better India, Population Foundation of India, and Children's Investment Fund Foundation, we are bringing to light various perspectives that are helping bring girls back. And to discuss that, I have with me experts who are solving these challenges at the grassroots level, who are continuously working to make and create an impact on the ground. So let me quickly introduce you to them, and then we'll jump into talking about the solutions that these people are coming up with and the kind of challenges that they are seeing on the ground and what can India do about it. So I'll quickly take you through the introductions. I have with me Deepa Chaudhary, the Director of Programs at Population Foundation of India. Deepa leads the delivery of the organization's strategic program objectives related to sexual and reproductive health, gender development, and family planning. She is an international development professional with more than 20 years of experience in India and at a global level. Deepa, thank you so much for joining us. Okay, we also have with us Pooja Marwaha. For the past 27 years, Pooja has helped build an organizational framework for child rights and youth. Pooja believes that children should be at the heart of all human development. It was her belief that fueled her passion for children's rights and inspired her to become a full-fledged part of the social sector in 1994. Today, Pooja is the Chief Executive Officer at CRY, India's leading child rights organization. Pooja, thank you so much for joining us. We also have with us Kumari Shibulal. She is the founder and chairperson of the Shibulal Family Philanthropic Initiatives. The organization emerged from Kumari's vision to transform lives through education with initiatives like Vidya Rakshak, which provides children of martyrs from Central Armed Police Forces via BSF, CRPF, CISF, and Assam Rifles, etc., with scholarships. And it is designed to support the children till class 12. Passionate about doing her bit for underserved communities, her vision is to level the playing field through education. Kumari, thank you so much for joining us, ma'am. And we also have with us Sonal Kapoor, the founder director of Protsahan India Foundation. Sonal has pursued child protection law from National Law School of India University and Harvard University. Protsahan worked on bridging the gap in childcare systems by introducing an empathy-based system to heal childhood trauma and transform girl children who are either survivors or are at high risk of abuse to reach their full potential. Under Sonal's leadership, Protsahan has rescued over 948 girls and reached out to more than 72,000 vulnerable children every year through arts and technology-based mainstreaming programs in slums of New Delhi. Sonal, thank you so much for giving us your time.
Happy to be here.
And we also have Medha Onial. Since 2021, Medha has been leading the strategy for Pratham's girls and women programs aimed at bridging the learning to livelihood continuum. She has also been working on Pratham's COVID-19 response. Earlier, she co-led Pratham's livelihoods focused organization, where she spent 5 years scaling and strengthening its impact. Medha, thank you so much for joining us. Thank you, everyone, and thank you, the audiences. We'll jump into our questions, and while we are discussing, whatever questions you come up with, please put them in the Q&A box. We'll take them at the end of our discussion. And yeah, let's get started. So, Pooja, I'll start with you. I didn't bring up any numbers that we have been coming across because I just wanted to understand from you, if you could help us understand the current situation. What, according to you, has been the biggest impact of COVID-19 when it comes to education of girls?
Yeah. So just to give a caveat in the beginning, I think we as yet don't have very reliable data coming in on re-enrollments, but it's begun to come in now because the schools are opening. What we do see is a very high level of enrollment during COVID time because that was linked to take-home rations. So just putting that caveat down. But if you look at the numbers that are coming out from estimates by UNICEF, if you look at the learning level loss, then we are really scared that the number of girls who are going to drop out is going to be much higher than it currently is, which is already, we already have about 32.7 million children out of schools, right? And we know that around 13.5% of the girls in that age group of 15 to 16 remain out of school. So we are already pre-pandemic, because some of these numbers are from the NSS rounds of 17, 18, the UDICE of 18, 19. So we already know that the age group, which is beyond the RTE, in that we literally are dealing with a really, really large, like 13.5% remain out of school. When we look at re-enrollments, the dropout scenario, we are finding that among the dropouts at secondary level is 15.5%, which is much higher than in the primary and upper primary. So while there is a lot of focus on keeping girls in school in primary and upper primary, the dropout figures were not nearly so worried. So I think, as I said, the fact that there is no right beyond the age of 14, and therefore it becomes an expensive proposition for parents and for society as a whole, the dropouts are increasing. We also know, so for CRY, for example, from our vulnerable communities, the data on child marriage has jumped by almost 3 times. So just the number of potential child marriages identified and the ones we could prevent and the ones we could not prevent jumped 3 times over our previous year numbers with the same populations. So just if I go by own primary data, if the child marriage numbers are indicating a trend, these girls are going to be lost from the education system. Because there are the chances that they will be re-enrolled have just come down by that huge percentage. So I think the number of out-of-school children, which is already 3.22 crores, and it's likely to have increased by at least 10 to 15%. I had some numbers from UNICEF, but those were more for South Asia. As yet, as I said, I think in another couple of months, we will know what the real-time situation is as schools open and we see how many children and girls especially actually re-enroll.
Right. Sorry. Pooja, could you mute yourself? I think there's an echo. Yeah, thank you. No, just the statement that we might lose these girls completely from the education system is a very scary statement. Which brings me, Sonal, we were having lots of discussions in the last 2 years, and you spoke, and I also heard you in several panels where you were speaking about how this impact is more than just the digital divide when it comes to education, because digital divide was a major focus, but it is more than that also on how the extended impact will be more and more visible sustainable over the long term, because it is affecting several aspects of the girls' lives and their families' lives too, which are not being spoken about. Could you help us understand the same, and also elaborate on the kind of policy level changes that you think are required to reverse this?
I think I'll take the second part first, if I can, Tanya. I think a lot of conversation that we have as a sector generally on policy level changes, we don't need any more new policies. I mean, if there was ever a choice, I would probably say, jo hai usko, let's implement that first. But I think, of course, we can always talk about, strengthening and easing the adoption process, keeping the same protocols and better protocols in check, looking at how childline can be strengthened. Of course, the same policies that exist, we can prioritize which ones to kind of, invest more and better them rather than looking at newer ones, for sure. But I think the first part of your question, Tanya, which is more about the digital divide and the, how it was just not that, but so much more. Let me give you an example. I think all of us who've been working with children and girls in extremely vulnerable spaces, we guys know that, somewhere there's this constant push that in the donor community also, and I'm not saying with us, this is a sector issue, that there is always a need-based funding or need-based budgeting and a lot of rights-based funding or rights-based budgeting. Now, something like a digital divide or something like the access to digital devices is still easier, if I dare say, because it's about distributing. You raise money from donors and you distribute the digital devices. But if you're working on a policy perspective, if you're working, some of our work involves very deep trauma counseling work with survivors, or there's this lot of conversation that started about COVID orphans. I'll come to that a little later, how that is also very problematic beyond a point. And how the focus then just gets into, hey, what is the next best new topic which is there in the newspapers? Is it need-based? Then the chances of it getting funded, quicker are easier. But if it involves more intersectional approaches, or if it involves rights-based approaches, it's difficult to raise money. And also, I think the media, we speak to a lot of friends in media, and this constant piece that we keep telling them is, yes, for example, the latest one, right? COVID orphans was a part of, the issue, but it was a part of the whole issue. Maybe 5 to 6 to 7%, of the larger issue. The other 95% part of the issue was where children were being sent off for transactional sex. कि वो 2 घंटे का 5 घंटे का sex work करके आएगी, तो she gets 5 kgs of chawal or atta in return. And we've been there for about 11 and a half-ish, 12 years, Tanya. We have seen some insane amount of cases on the ground, but the extent, the amplification of the number of cases and the extent of the same cases. So we've always had incest cases that we were trying to help solve, get into the system, get the compensation, do the trauma counseling with the survivor and other pieces. But this is the first time when we started, recording a lot of data. We were also a small organization, we were trying, reach out to more children and more girls. But since last year, as we started looking at the data, the trends, which I think Pooja spoke about extremely beautifully, the data is, the trends are giving you some, crazy statistics or insights, which are, हमने देखा जो COVID orphans के cases हैं, right? वहाँ पे जो अगर, for example, in those cases, for example, where one primary caregiver has passed away due to COVID, if the fathers have passed away, and these are extremely vulnerable families that I'm talking about, the mothers have gone a step forward and beyond, and either taken job as वो बिल्कुल पढ़ी लिखी नहीं है, but she's taken as a thing as a domestic helper, or कुछ extreme cases में she's gone to do whatever to provide for her children. But in those cases where the mothers have expired due to COVID and the fathers are left behind, they have ended up abandoning the kids, right? NCPCR also बहुत latest, they submitted affidavit in the Supreme Court, which very clearly stated a couple of months back that 1 lakh children, and these are just the statistical numbers, right? That 1 lakh children are in need of care and protection. It surprises me because even in a pre-pandemic state, there were 1 crore or more children who were in the need of care and protection. So COVID way, the situation has only been exacerbated. And this is way beyond just the digital divide. It's the sea of broken children. There are cases, Tanya, where we see on the ground that children who've been thrown out of schools because छोटा private schools जिनका वो हिस्सा है, now they can't pay their fees. So because of chaos and confusion in their minds, there's this 11-year-old who cuts her hair haphazardly. She cuts her clothes haphazardly because she's confused. मैं अब मेरा स्कूल से मेरे को निकाल दिया गया तो मैं लंबे बाल रख के क्या करूंगी? That's her understanding as an 11-year-old. Nobody is looking at the chaos in the minds of these children, of course, because it's not as tangible, it's not as needs based, कि ये बांटा और ठीक हो गया. This is long term work that requires long term investment, and not a lot of people are talking about it other than school mail, CBSE के board exams or unit tests हम कैसे देंगे. We have to take the conversations beyond that.
Yeah, for sure, Sonal. Some very important points that you have raised. One of the points that you were initially talking about was also funding, and I really wanted to quickly touch on that also with you, Kumari ma'am. Having worked with children of the underserved for decades, kindly elaborate on the role that funding will play, like in the situation that we are in today. The role that funding will play to help organizations like the organizations that we are talking to today to bring girls back to schools, right? Is there a need for any innovative funding models, or the kind of the models that are working today, are they working? What is the situation like?
Actually, we have this program called Vidyathan, and that is a need-based scholarship for higher studies. The children after 10th grade, so a lot of children drop out when after they finish their 10th grade, either they pass or fail, whatever it is, because they're earning age at that time. So we started this scholarship about 20 years back. So that time we never thought of scaling it up. So after a few years, we started with 2 children, and then after a few years, it became 4 and 5, and it became 100. We started in Kerala, and then so we thought we will take 100 children 1 year, and then that scholarship continues for whatever they wanted to study. It will be about 5 to 7 years, whatever they wanted to study. So this scholarship continues, and then I was planning to take only 100 students per year. So about few years back, about 10 years back, I had to select about 120 students. So I cannot say no to those students because they are all very deserving students. And by that time, when we started in another states also, like Karnataka, Tamil Nadu, and Andhra, and all that, then we had to, for scaling it up, so we need to ask someone else also like us to fund it for one child. So we start asking other people, like, can you, whether anybody is ready to sponsor a child for their education. It's because we had to do it when the child is about 18 years old, because we don't want to expose this child before they are 18 years old, because a lot of them are girls and boys, but they are minors, so we did not want to do that. So after their +2, that is the pre-degree or whatever, in different states is called different things. So we started asking, and then people started sponsoring. So now there are about 100 sponsors are there. Some of them are sponsoring about 50 to 75 children, one sponsor. Some of them sponsor, some of one child, and somebody sponsor one child, 2 children, and like that it goes on. But mostly, actually, we are the people who are after getting the fund, so they are going around and asking people, and even through our friends also, we have many people who are sponsoring those children, and 60% of them are girls. So 60% are girls, and after like these 20 years, we have many doctors and engineers and even nurses are all came out, and they are all working in different places. And they're actually when they come to us, so they had this ambition that they need to study, they need to become an engineer, they need to become a doctor. So we encourage them. And we used to have these career development courses, and all those we were doing every year. And so that helped them a lot. And so when they come to us, they did not know what to study. So all of them will say they wanted to become a doctor, engineer, or an IAS officer. There is nothing, they never heard of anything else other than that. Now, even now I am doing the interviews for the children. So this, I just finished it about an hour back for today's section and came in. And today we are in about 11 states now, and we take 1,000 students per year. So from all the states, and some 4,300 students are in the roll now, and 17,000 children are already being helped, and they are out already and they are working. And we did a survey with IIM Calcutta about how these students are doing. And we came up with this thing called, it's the after getting a job, and it is immediately after their studies, because they are all very, very bright students. After finishing their studies and after getting, they, within 2 years, they will become, out of the BPL level. That is the thing. It is very, very, satisfying thing that we can get. And every other month, every month, I get these marriage invitations, or so they will inform me, so they got a job in different places and things like that.
That's awesome.
Yes.
Yeah. No, really, I wanted to touch upon this because funding also forms a major part of the solutions. And when we hear about how different people are doing it, we get some ideas from how different organizations are functioning as well. So talking about solutions, Meera, let's jump into the solutions, right? So if you could take us through some of the steps, since you were also managing the COVID-19 response at Pratham, could you talk about some of the steps that Pratham has taken to bring back girls to schools in these past 2 years, or some of the steps that you could elaborate on that have worked in these specific to these past 2 years?
Sure. So I'll just take a minute also to touch upon what Sonam mentioned about funding. I think it's crucially important, and it's just important to highlight that one part of it is that there's some sectors that get funds, there's some sectors that she mentioned which are very rights-based that typically struggle with funds. There's also a larger issue, and we don't even need innovative funds, as you mentioned. We just need better allocation of them. But a lot of funds just go to specific regions, right? CSR funds are typically around regions where there are manufacturing units and corporate units based. So I think at least 2019 data was about 45% of funds go to 4 states: Maharashtra, Gujarat, Karnataka, and Tamil Nadu. And places like Uttar Pradesh and Bihar with high population densities don't get states. So I feel like this backyard funding is also a very big part of what needs to be rethought, and lots of underserved areas and remote areas get left behind. So I just thought I'd quickly add to Sonal's point, because that was an important one. Coming to solutions, I think Pooja also mentioned, I think right now there are lots more questions than answers, right? We still don't know what those numbers look like of how many students are going to come back. I think the couple of places that we've seen schools reopen, for instance, higher secondary education and high schools have opened up in a lot of states. I've been visiting UP, Bihar and Odisha specifically, and going to some of the tribal residential schools, which also luckily mitigate for another problem that Pooja mentioned earlier, which is that they're funded till 11th and 12th. And so that barrier is at least lower. We're still seeing it's going to take time for people to come back, right? So Abhi, there was Chhat Puja and a lot of other factors that because of which students hadn't come back possibly, and let's hope those numbers increase. But I think concentrated effort will have to be made, right? So I feel like there are larger socio-economic reasons that people are not coming back to, and I think Pooja, Sonal, and Kumariji may be better placed to speak to them. I feel like there are 2 bits that have really struck to me during my last couple of months of being on ground and visiting places. I think again, Pooja had mentioned that learning outcome fall is a big problem, right? So I think when you look at girls not coming back to school, I think the big question to ask is who is not coming back? And one thing that we're seeing is a lot of girls who either themselves feel like they're not learning in school, right? Like, so all of information is stored in words and numbers, and ASAR data every year shows you that most kids can't read or do math. I think 50% of students in grade 5 can't read grade 2 text. Lots of them can't do division. And so if you don't think you're learning from school, there is a part that's unlikely to want to go back to school. But more than that, if your parents think you're not doing well at school, your grades are low, we're seeing, at least anecdotally right now, we're seeing that those students are also very unlikely to come back. Students who are on the lower end of the performance spectrum. So that's an easy concentrated effort that can be made for catch-up sessions to get students back to school, right? Again, I'm talking of very low-hanging fruits. They're larger, difficult, child marriage and other issues are a different ballgame to tackle. But at least students who are not coming back because they haven't learned enough is an easier one to work on. At the other end of the spectrum, COVID has done one thing, right? COVID has reduced the gap between school and home. Earlier, padhai school mein hoti hai and then you come home, right? Now, padhai ghar pe bhi hoti hai. So that bridging of school and home that's happened needs to continue. So we also see that a lot of, especially high school and adolescents, when girls drop out, I think it may be important to look at, again, where are they dropping out from? You often see a lot of these decisions are community decisions, right? So if one student from a village, primary school is present in every village, a high school typically is present in a cluster of villages. So if one girl from one village is not coming back, very likely others won't go back as well. So getting this connection right, that if you're in a school, I think schools need to go back to villages also right now. And we need to figure who is not coming back. Is there a group of students in concentrated regions which are not coming back? And to be honest, in my experience of these schools in Odisha that we went to, attendance was higher than an average attendance I would expect. So about 80% students had come back. But the ones that hadn't come back were all primarily from the same village. So those group decisions, so there's some easier solutions that I'm speaking of, not the trickier ones, but these are very easy to do, right? When you already have an increased connection with homes, can we see who is dropping out and why? And going back to villages to understand why they haven't come back, I think is crucially important right now. There are multiple factors, but some of them are easier to tackle than the others, right? So this connection between school and home being continued, and students who haven't been learning, and those learning levels have fallen for sure. Students haven't been studying and digital access is abysmally low in many regions. So how do you bridge these two gaps, I think would be crucially important to address as a part of the solution. But I'll pause. I think there are lots of other things that other organizations are doing, and it'll be great to hear from everybody else.
Thanks, Medha. These points make a lot of sense. Deepa, I'll come to you quickly. Based on your expertise, I wanted to ask you the question of elaborating on the impact of this dropout rate that we are talking about and the larger impact on girls' sexual and reproductive choices in rural India specifically. Like Medha was also talking about villages right now. If you could elaborate on this specific part, sexual and reproductive choices in rural India, the impact on this point based on the dropouts that are happening.
So, I think as Pooja already mentioned, and many of you all have mentioned, obviously there have been different kinds of impacts, especially around as girls have not gone to school, they have, I think child marriage is like the first thing that has really hit girls in rural areas. We know that we already know that in cases of disasters, child marriages tend to go up because parents, they have less money. For girls' security, and when you get girls married young, you pay smaller dowries. So this we know from previous cases is happening. We of course don't know for sure what's happening in the ground, but I think there've been so many media reports and so many reports even from where where we are working in Bihar and Rajasthan. We've seen that there have been reports from the ground that there have been lots of child marriages that are being planned. Sometimes they are being prevented, but very often, it's done like underground and you have no way of knowing. Families are migrating. It causes even more problems of keeping track of what is happening. We also know that Childline, even during last year's May-June closure, there were a lot of calls that came into Childline specifically for child marriage. And the number I have is that 5,584 interventions were made by child marriage in this very short period of May to July 2020. So this is like one of the biggest issues that I think as far as young people, young girls, what they're facing when they don't go to school. The other thing is that we know that when they don't go to school and if they're married, they are most likely, not going to be able to access contraception. They are most likely not going to practice safe sex, for example, and there are likely to be a lot of unwanted and unintended pregnancies. We again don't have absolute numbers, but we know that UNFPA has globally estimated that there would be 13 million, sorry, this is for child marriages, 13 million additional child marriages, but there have been estimates for unwanted pregnancy. Now, these are all estimates. We don't really know what is happening. We also know that when we also know from even before the pandemic that young girls who are pregnant under the age of 18 are less likely than older women to access institutional care and pregnancy care, formal pregnancy care. Now, this, if there are larger numbers of young girls who are likely to be married, likely to be pregnant, that too, those numbers will go up. And this is not, this is not a matter that you cannot have services for, whether it is young people, when it comes to antenatal care and pregnancy care. We know that there have been cases where during the early part of the lockdown, there have been women and girls probably who've not had access, who had reduced access to pregnancy care. We also know that fewer, the lower the number of years of education, it is related with larger number of births. So it also sets, when girls drop out of school, it also sets them up for having repeated and pregnancies, repeated and with shorter spacing between pregnancies. That is another big issue. So I would say that, there is a kind of knock-on effect from girls not going to school and therefore falling into, getting into child marriage or trafficking, as Sonal said, and following through with other issues around unwanted pregnancy. We also know that abortion has increased, abortion amongst young people. Now, youth-serving organizations have reported that they have been 12 times more likely to have been approached for abortion services. So all these are just indications of what the situation in the ground is. Again, it's hard to come up with national or state level data, because this is all reporting from smaller NGO projects. Thank you.
Okay. Yeah, and that's why I wanted to talk about it, because the more conversation I have with people like you guys who are on the ground and organizations who are really working, the first respondents and the people who are really working with these girls, the more it shows how, if we just concentrate on the mainstream headlines, all these ripple effects are just not being spoken about, and they're so important to be talked about and solutions to be discussed. Pooja, will come back to you with the solutions. Like I was asking Medha, what are some of the solutions that CRY has implemented or is planning to implement along these lines of dropouts and girls coming back to schools or their families being helped out?
Okay. First, actually, a couple of just references to what other people said. I was just thinking, in the area of policy, it's actually really rather simple. If we implement the new education policy, it itself, it promises us universalization of education, right? It talks about setting up a gender inclusion fund for ensuring girls are in school till 12. Yeah, it talks about setting up more of the Kasturba Mahavidyalayas, for example, right? The ones Medha was talking about. So in itself, I think policy implementation, if backed with adequate resourcing, is definitely something that would really help, especially at a time like this, where we could create pull back into schools. On the solutions that we've looked at, I mean, the first really big one is, I think we need to find a way to ensure that public education access and infrastructure is improved for safety, creating the safety protocols so that as we go forward, and everyone is saying as we go forward, because of climate change, these disasters are not going to go down. They're going to go up. Can we afford to once again keep our, 36 million children out of school for 1.5 years? We cannot, right? Internet access is, I mean, in our areas, frankly, people are saying 20%, but I can tell you from CRY's own experience that it was not more than 4 to 5%. With all the effort that organizations like ours put up, we could push it to 14, 15, 20%, in some spaces. So I think preparing for that is something that's going to be critical. How do we keep schools up and running so that, and to me, this is a critical point. While, I agree that school motivation comes from when I'm learning well, but schools as a space of protection for young girls. And so, for example, one of the things we've done is, and we've never done this before, is just done these, trying to do these focused bridge courses right now for the last 6 months, which is just bring children back to some learning. And it's not like we've got highly qualified teachers or anything, but children are just so delighted to sort of learn again, and we are hoping that that will give them that little fillip to get back into school. And this is something which is low-hanging fruit. I mean, Medha put it so beautifully, right? This is something that can be done across. It can even be done through government school teachers doing. And a lot of government teachers we have seen, like in Telangana, it was amazing. In the second wave, the government teachers did not take leave in summer. They said, we're going to continue to go to the villages and gather the children in the verandas and the maidans the way we have been, so that, kids continue to have some interest in school. So while this has not happened across, but to me, that's definitely one huge set of solutions. I think the other solution is really that we all need to join hands with the system, whether it is Childline and the protection system. So some of the things we've done is actually deployed volunteers to help the local DWCDs in states to track down children, to see what's happening. And the alarming fact about everyone's making a fuss about the COVID orphaned children, but the one parent loss is a far larger number and needs far more proactive and quick help. And most of the states do want to do it. I think sometimes it's just a matter of resources. So I think tracking, if we are on the ground, we have access. We know our children, our communities, our families. Like CRY covers 2.5 lakh families. Pratham is 10 times that, our ability to sort of get that information to the system. I think to join hands and say, here are these children who will need these interventions, and obviously linking them to the schemes which are available. So really making the policy work, to my mind, is a big thing to do. And I think I would say to everybody, alert, alert, alert. Wherever we know that, for example, in our northern states, the Anganwadis just closed down. All the services were redirected to COVID. So the immunizations that were happening, or the pregnancy care that was happening, what Deepa was talking about, all of that just bluntly got stopped. So I think, whereas I actually see the other states, and it's very interesting, they were kind of paralyzed in the first wave, but in the second wave, they were not paralyzed. They found a way to continue immunizations. They found a way to keep a lot of services going. So I think keeping our eye on ensuring that the services are going. In fact, the other day we were sitting down and looking at the data on malnourishment. Now that's another area where we're all so fearful because children have not had their hot midday meal. It has gone to their homes as take-home ration. The whole family has had it, right? So in the end, for the child, the nutrition she requires and the reason that the midday meals were created has got undermined, right? So therefore, restarting and ensuring that that happens. I just think there are these four, we need to look and understand that schools, and especially for girls, are a space of so much more. They're a space of protection, they're a space of nutrition, they're a space of expressing themselves. Another thing we found in CRY at this point of time, and I don't want to keep talking about what we did, but we found this very interesting, that the membership or the attendance in our adolescent groups went up because girls had this need to be in a space which is not coercive, which is not, we know domestic violence went up. We know violence went up in homes. And therefore, to use those spaces effectively so that girls know there is someone there for them, where they can, fight the child marriage or whatever. And I think the next thing that we've all learned, and I think as a sector, because I've listened to so many people, is those of us as child rights organizations who were ignoring parents, who were so busy making alternative spaces for children, have learned that we are going to have to enroll parents. The number of people talking about now equipping parents with, especially 0 to 6 age group stimulation skills. The number of people acknowledging and understanding that unless we work with communities, it's not going to work. So yeah, I mean, I'd stop here because everyone has so much to say. But it's just, I think we really need to pay attention and just be alert and just realize that this is a bad time for children. This is not work as usual.
Yeah, and it always just blows my mind when I speak to you guys and see the gap in information. And like you said, alert. We need to talk about this way more to everyone, like to people like us who do not have any idea about what's actually going on the ground and what you are seeing. And there's a huge gap between these two things. Sonal, my next question is for you, but I'll quickly ask Deepa her next question because she has to leave for something urgent. Deepa, so like Pooja was mentioning, right, all these additional problems, say, for example, midday meals. No one is thinking about what's happening over there. Menstrual hygiene is also one of those things, right? Like how the adverse effect this whole situation has had even on menstrual hygiene of girls. Could you talk about that and also focus on some of the solutions that you have worked on, or some of the solutions that the government can help implement in these schools with regards to specifically menstrual hygiene, and now that girls will be coming back, or the effect that it has had when they are not in school at all? Has it had an impact? Sorry, Deepa, you're on mute. Yeah.
Menstrual hygiene seems like something quite trivial compared to many of the other issues that everyone's talking about, but it is an important part of whether it's girls' sexual reproductive health and rights, and it sometimes does impact girls' attendance in school. We've had a program, there has been a menstrual hygiene program that the government has been running, and in many places they have. They distribute sanitary napkins. Now we know that is kind of patchy and happens in places and doesn't happen somewhere, and it depends if there are there are stocks or stockouts, all of that. But we'd also know that under this crisis situation where schools have been closed, girls have not been going to school, and even where school has reopened, and it's going to be quite a while before all the supply chain management issues are taken care of as far as menstrual hygiene, distributing of napkins is happening. So what happens is that girls have gone back to using traditional methods. Now that would be fine if they were using cloth, but we also have known from all our previous years of work that the hygiene maintained with you reusing cloth napkins is not very good. Now, this is where the situation is, and we also know that poor hygiene as far as reusing cloth napkins do tend to cause infections at certain times, and girls are very reluctant to access healthcare workers in case they have infections. So it's a kind of a rolling situation where it goes from bad to worse. Now, what are some of the things that we tried? Population Foundation of India tried in the different locations that we work in, especially in Bihar. The girls opened something like a napkin bank where they were buying napkins and also putting in money where they replenished this bank. And it was really popular in the areas where this worked, to the extent that the girls started to distribute napkins, not only amongst themselves, but also to women who could not buy napkins. So that was really a wonderful thing, a wonderful kind of solution, a local solution that the girls found. We also in Rajasthan, in an area in Tonk where we work, the girls were really upset. It's upsetting when you're used to a certain kind of product and then suddenly you don't have, and you have to go back and use something that is kind of, you've stopped using it and you don't want to go back to that place, to that situation. So these girls made a video and they spoke out loudly about why they needed napkins. That video was presented to the district administration. Where the girls were pleading for napkins, and the district administration actually put in money to, their own money, even when the schools were closed, to make sure that the girls in this community received napkins. Now, these are just small, heartening stories, but I think from the point of from the larger context, I think we can certainly have other ways of distributing. So Pooja, you mentioned, for example, services were impacted, but to some extent they've come back on. Of course, the ASHA ANMs were very busy with managing COVID. But is there some way, and they were visiting house to house, is there some way where they could have distributed napkins? We could have done like a box delivered to a home where you had maybe some dry ration or some IFA pills, maybe even some, and sanitary napkins distributed to households where girls are there. Because at the local level, ASHAs do know where the households where there are young girls, adolescent girls. So that could be one of the larger solutions that, and this is something that someone else said, that this is not the first and last crisis we're going to face. So this is going to happen, whether it's floods or famines, and with climate change, we don't even know what's coming. So I would say that, when we plan for recovery from any disaster or dealing with any disaster, there should be a focus on the special needs of young girls. And within that, taking care of their sexual reproductive health needs and many of the other things that people are talking about needs to be considered, and alongside many of the other things, whether it is, providing fresh water and other kinds of supplies, you also need to be looking at this issue.
Thank you, Deepa. I know you have to drop off, so if any questions,
so sorry, we're gonna, something
that's
urgent.
absolutely okay. If any questions specific to your work,
if I can, I'll join back, but
yeah,
please excuse
I'll
me.
pass them your way.
Thank you so much.
Thank you so much, Deepa. Sonal, since you work with girls who are at the risk or have faced abuse, first I was going to ask you about the biggest risk which is facing children dropping out, but I think that is somewhat answered in your previous answer as well. I wanted to ask you about having rescued so many girls, vulnerable children from these slums. Could you explain the importance of art and technology based education in such cases, because that has been your expertise?
I think, Tanya, I'll take a little thread from Deepa and Pooja both, because I think everything that all of us are saying, and I think making a strong case for, is that अब आप सिर्फ एक मुद्दे पे एक छोटे से कस्बे में काम नहीं कर सकते हो until you are intersectional, until you are looking at very holistically. So in the non-profit sector, there's this, probably sometimes people joke around that, holistic model, another holistic model of doing XYZ, but Pooja is smiling. But I think bina holistic models ke, what are we trying to achieve? Are we trying to say, hey, okay, we have just given textbooks for these girls, so yeah, rest of the thing is not a part of my problem. and we have given text. So we have had, some corporates coming up and saying that, we only want to, for a little tiny funding that, instead of doing very deep immersive work for 30 girls, we would want to just give registers and textbooks for 1,500 because it looks fancy on my annual report. And very few HNIs, in fact, our partnerships with people like Divya Modi, our partnerships with people like, Salesforce, I think a few of, or APPI for that matter, these are some of the fantastic donors who believe in intersectionality. These are some of those fantastic, donors who come from this perspective ki sirf ek cheez dekh ke you're not trying to solve any big problem, right? Having said that, I think somebody spoke about the Asha Anganwadi piece, but again, we forget the systemic lack in the whole piece. जब उनको दिल्ली में धरना देना पड़ता है for their 8 months of salaries not being credited, why are we expecting an Asha Anganwadi worker or a government school teacher to be performing her duties? When the donors say, oh, salaries of people are not important, why are we, or field staff is not important, do the need-based distribution work of XYZ. जब आप expectation setting system को तोड़ने की कर रहे हो, how do we as civil society, or and I think Pooja spoke about this so beautifully in the beginning, that it's time for all of us to work together. We have to work with the system. We can raise questions and all of that, but at the end of the day, some of the best practices that DCPCR has come up with, which is the Delhi Commission for Protection of Child Rights, some fantastic policy level schemes. So rather than a Protsahan coming up with a scheme or an XYZ, we are community based organizations. We can help the system link better with the last mile child. Or for example, one of these connecting threads that I think everybody spoke about, starting with what Kumari ma'am spoke about, the scholarships piece. Usko 1 saal ya 2 saal ka, she just needs that little bit of support towards the end. If she doesn't get it, she drops out, right? Schools closed out. The two biggest things I think everyone spoke about, so I will not detail about it, but midday meals and sanitary supplies. We had this case where, for the first time with the sanitary napkins, we had to, with all the menstrual hygiene sessions and every other piece that we do around, when we are working with the girls on this issue. The first time the girls came back to us last year after the first COVID wave, कि हमारे पास panties भी नहीं है. What will we do of sanitary napkins? There were still teachers in schools who were saying that, who didn't know, because there were hordes and hordes of sanitary napkins, but no girls to really distribute. So they started using it as dusters in the classrooms, right? So I think when you hear such stories, there's a massive systemic gap at the awareness level generally, and at the tracking and audit level, right? So much of COVID orphan piece that had come out, right? How many organizations or state governments or central government or NGOs or multilateral agencies will be following up this issue as a longitudinal study for the next 2-3 years, tracking out that children who've lost one parent or both parent, what were the intersections of services that they needed? Just saying that 5 ya 10 lakh aapko after you turn 18 or 21 you will get, who is looking at their stuff today, right? Because otherwise you are raising broken children, right? And this entire if I have to connect, so one of the approaches that has worked with us at Protsahan is something that we call the HEART approach, which is as simple as HEART, which is an acronym that we say, which goes a step beyond and says healing is possible. Healing is important, right? And healing how? Through education, which is a non-negotiable. So H for healing, E for education, that's a non-negotiable. A for art-based life skills, that piece that Pooja spoke about, right? Expression. There's so much of trauma that, these girls who've been either dropped out, who faced violence, or, child marriage se bhag ke aayi hai. There's so much of stuff that they're carrying within, and no child-friendly space to express it, right? So how these art-based or, these pieces kind of flow in with that, just sirf education is not going to do it. And I think moving, just to add on to this point here, that also the education space in our country, you cannot look at education, even in a civil society space, as a silo. It has to be looked at with child protection, otherwise it does not make sense. We can keep fighting about the RTE, but if we do not understand the Child Labor Law or the Child Marriage Prohibition Act, who are we trying to kid? If one health ministry is, look, an education ministry and the labor ministry and the migrant issue are all separate ministries issues, right? These are of course larger questions for larger days, but the intersectionality piece again, the community ke saath, adults ke saath kaam karne wala piece again, because without that, we're looking at hollow solutions, right? So A for art-based life skills, R in the heart for recovery from trauma, because again, the trauma-based counseling, compassionate care, spaces that these girls will kind of grow up in, and T for technology for mainstreaming, right? Because we have realized that sometimes a lot of people ask us, do you want to open 25 different centers in the country? And we're like, no, we don't want to. We sometimes just want to say that the approaches that have worked in these 60, 65 slums where we work, from these 5-6 centers, we want to take these approaches to every orphanage or every childcare institution in the country. There's been so much conversation about if the child has lost one parent or both parents, put the child in an institutional or a childcare home. हर बच्चे को institutionalize करने की जरूरत नहीं है. If there's a dadi or a nani or a great bua or a masi which is taking care of those children, one, if those bhai behan or those siblings are separated before they go to an institution, what good use would that system and that scheme be? If we are looking at sometimes the child just needs just that loving care of somebody, of that system or the school, my peers, my friends, just putting that institutionalization, even the juvenile justice law of the country states, right? Hence, हमें ज़्यादा policy या innovative, all of these fancy words, at the institutional level नहीं चाहिए. What's already there, we need to implement that better. And we have seen that heart approach in our, or heart principle, as we say, has worked beautifully well, not just at an anecdotal level, but a statistical level. And the true, I think, test of any approach working or evidence really forming is when the same anecdote can extrapolate to a large data set, and any of those data sets can come back as a great anecdote. And I think heart approach has kind of worked for girls who are at the risk of dropping out, who are dropping out, who are facing violence, probably might never come back to schools. It's a massive gap. And I think I was reading something that said this year about 10 lakh girls from in India would probably never go back to schools. Now, this is in addition to 4 lakh kids in 9,500 orphanages or CCI, childcare institutions in the country, which are already languishing. So unless we look at child protection as an emergency issue in the country, at least now, we can have all the conversations and nothing's going to come up if it's not the system, and system having the trust on NGOs, right? And NGOs then supporting the system to take their schemes and take their work to the last mile, because we have our eyes and ears on the ground.
Thank you, Sonal. Intersectionality, like you said, seems to be an extremely important point. And the one thing that you said, that there are several common threads among everything that all of you are saying, also amazes me on how on the extremely same page all of you guys, at least on this chat, are. And with that, I also want to bring in other organizations on the ground, like yours, which are working. Like Sonal also said in the starting, there's so many of us doing this kind of work. Kumari ma'am, I actually wanted your advice for these kinds of organizations, the other organizations working on the ground, and even the various stakeholders, right, who might be trying to work right now in this specific field, trying to work towards better education of girls in the country. What would your advice, based on your experiences, be for them?
Actually, in my experience, from my childhood onwards, if I say, I was the first one to graduate from my village, and none of the children on those days went to school. They went to school, but during the harvest time or anything, they were, out in the field. But my mother insisted that I should go to school and complete my education. So that is the reason I'm here now. I am one of the living example of, my mother's wish, or, I feel like, the ladies of the house and the mothers, we need to educate the mothers, why their child should go to school and get education. And so most of the families, the affordability is an issue, because when the child become about 10 or 12 years old, it's an earning age, and they can send them out and get the money. But somehow we need to make the mothers understand that there is something beyond that. And by education, the whole generation will get educated and their generations will get better. So
Yes.
I feel like, the mothers has to be educated, and the mothers have a big say in that.
Yeah, thank you, ma'am. Before I move to the questions of audiences, Medha, same question for you quickly on the advice for different organizations. And also, I think you wanted to say something earlier, but I had missed that.
I was just saying, I think we all uniformly agree on one thing, just restart schools. It's been 500 days since schools have been shut. I think the singular thing that we all agree upon is if you go and ask a child, do you miss school? They'll all say yes. Whether it's for studying or for other reasons is a different matter altogether, but everybody wants to come back to schools. Mothers need a break from their kids, so mothers will be happy to send their kids to school. So just like we need to all uniformly open schools, and it's a travesty that they've been shut for 500 days. Everything else has gone back to normal. In Bombay, you can go to movie theaters with your children, but you can't send them to school. So I was just basically agreeing to, I think, what Pooja was speaking at the time, that I think that's the one thing to do. The question that you asked right now is advice to other organizations.
Yeah.
That I think everybody's doing the best they can. Right now, every small bit helps. And I think just the fact that we shouldn't go back to what we were doing before. A lot of lessons everybody on this panel has discussed, whether it is we all need to look at a holistic approach. We all need to ensure that we don't just look at the small bit of child education, for instance, but look at the family, look at nutrition, look at all those other aspects. I think we can't go back to normal. And so everybody is waiting for things to return, but some lessons should continue. I think that's primarily it. But yeah, I think communities have known best. We've learned in the entire crisis that decision-making top-down is one way to go about it, but empowering communities, kids know what's best for them, parents know what's best for them, schools know what's best for them. I don't think any of us should sit here and decide what should be done for communities. So I feel like that's all I wanted to add.
Thank you, Medha. I have so many more questions, but I don't have time. So I'll quickly take one or two audience questions before I sum up some of these points. So there are two common questions around helping organizations like yours. So one person is saying, if I want to, thank you so much for these insights. I'm a listener. I would like to contribute something in some way. And how can I start? This is where he. And we have another similar question on if I want to sponsor, which I think means contribute to one of the organizations. How can I do that? So I would take one is that they could all go check individual websites of your organizations, which we'll share with them. Anything else, Pooja, to add to that, if you would want to take this question?
I think one of the wonderful things we've seen through this time is a huge explosion in online volunteering. And I think a lot of young people have come forward to either do crowdfunding, with their friends and families. So go beyond giving, but actually stand up for others publicly and, invite others to come in and contribute. And the other really interesting one has been, people volunteering to sort of teach online.
Yeah.
And, actually look at, probably not teach like core subjects, but stuff like it could be art, it could be other things that children needed to be engaged with. So I think one big thing I would say to everyone is hold on to this concept of being able to help online, because that will help organizations like us. And of course, please donate. I mean, that is always, all of us would say, donate to real costs and understand a little more.
Thank you. One point, I think, Medha, someone is expanding on your point only, that we need to look into who, which, and what age group of kids are not coming back to school. And we need to collect that data to grasp the whole picture and formulate solutions, if any, which I think you already made that point. I will quickly.
I have to leave. Unfortunately, I have another call that's starting. But
sure, Medha, sure.
Great session. Pooja, Sona, Mariji, it was really, really fantastic hearing from you. Thanks, everyone.
Thank you. So yeah, given the paucity of time, everyone, I think I won't be able to take any more questions. But thank you so much for joining, for the panelists and also the people who were watching us. And thank you so much for your insightful questions. I see many people who are saying that this is extremely insightful in the chat also. So thank you so much. And many people are also saying the same points as that came up in this conversation. I would quickly just like to summarize a few things, because so many interesting points came up. One was that without these solutions, these kinds of solutions that are being discussed, we'll have girls who are lost from the education system. And if the other ripple effect and the other changes are not seen, it will be a sea of broken children that India is raising. And we cannot afford that. We cannot afford to keep these children out of schools. We cannot afford to keep schools closed any longer. It has been 500 days, and we need to have them going back to schools. We, as from the solutions point of view, we need to see which students from where are dropping out, and is it how much is the parents' involvement in that dropping out also, and the schools also need to go back to these kids and bring them back. We also need to reduce the gap that has been reduced between schools and homes. We need to keep that as little as possible, and more importantly, we need to not look at how new things can be brought out, but we need to implement and improve the existing policies and situations on the ground. And we need to work intersectionally between communities and the system and the organizations to be able to work together and create a holistic solution and impact on the ground, so that nobody is ignored, and the larger issues, which are the lower part of the glacier, are also visible to everybody, people who can help, people like us who can just contribute and help online, and different organizations like these that are doing the actual work on the ground. So thank you so much. Thank you so much, Pooja, Sonal, Kumari ma'am. Thank you so much for your time today. It has been absolutely wonderful and extremely insightful. Thank you, guys. I'll see
Thank
you
you very much for putting this together. It was a pleasure to listen to everybody.
Thank you, Pooja.
Thank you, Tanya. Thank you, everyone.
Thank you, Pooja. Thank you, Sonal. Thank you, Sanya.
Bye, ma'am.
Good
Bye.
evening, ma'am. Good evening, Pooja.